no single organisation can support carers in Manchester. It's the second most linguistically diverse city in Europe. We've got an incredibly vibrant, diverse community that are spread across the city borough, and we need the specialisms that exist in the voluntary sector to cater for the needs of the people.
We had a lot of carers who maybe wanted them longer conversations with us because they were quite isolated at home, and I think for our staff we quite enjoyed having that sort of contact with people when we were working in severe lockdowns and weren't able to go out and have that contact with people as well. The carers we were speaking to were facing quite a range of issues. For some people it was around day centres and respite ending, or they were maybe looking after someone who was shielding, having to be quite careful about who could come into the house, where they could go.
LMCP is one of the organisations who just operate throughout the pandemic as well. So many organisations, they've been furloughed, but we decided we stay open for our carers as well.
We had to completely rethink everything. We were offering face-to-face services before the pandemic. That shut down overnight. Most of our support was then over the phone, over Zoom, so sessions or any one-to-one support, that was all done either digitally or over the phone. We did a lot of befriending over the phone, keeping in touch with people, just touching base, making sure that they were okay, you know, they weren't isolated, and making sure that there was some form of communication with them.
So what we've been doing is, first of all, seeing to the kids, getting a network going and telephoning, getting on Facebook. Even in the evening, my staff have been working, just to give them that bit of lift and to know somebody's at the end of the phone.
During the pandemic, there's loads of information flying through the social media and lots of people talking about COVID vaccination and death as well. So people are scared. And the connection is already completely lost. The people are worried. What will happen is they will try to get information access from the not reliable sources, from their friends, family or religious leaders. What we did is we told them, go to the trusted website, ring your GP and get that kind of advice.
And we've been running a blend of face-to-face and virtual workshops over the past 2 years. It was about getting people information. There were many support staff that were across the network that were just on a 2-week rotation of calls, just calling people all day, every day, checking in, reducing isolation and making sure people got that right information when they needed it.
Moving forward, for a carer, we want to make sure that they are supported every single step of the way.
I think the lockdown is very challenging for us because we've been told close the centre. Apart from the kitchen, our team always come and cook the hot meal. Every day we deliver to the community. The people live in the Chinatown centre or surrounding area.
For a lot of carers could not go to the people that they used to care for. To give you an example, a daughter could not go to her mother because she works in the healthcare field. She could not go to her mother to provide her with meals, so that's why we came in and we would deliver meals to her on a daily basis.
Putting in simple terms, simple language, this is what's happening, this is where you can go for a vaccine. Because if you've got a disabled kid, you're not going to be standing in the queue. We would make the appointments, we would make sure they got there, so we did all that.
Maybe those usual participants of those support groups didn't have this technology, so they just stopped being able to come. There has been a division which has been brought about by the pandemic, by the move to digital.
The Wi-Fi, the device they haven't got during the lockdown, our digital team already got the tablet from the Partnership Giving Foundation. We distribute, and some people know Wi-Fi data, so we also show them how to use it. I remember with Kara, saw her going out to the outside the lady house when we deliver the meal. We just scan out the letter, like there's a benefit letter or a hospital letter or even the shielding letter. They didn't know they're shielding. We explain and translate to them.
We had a trip to the RHS in Worsley and a carer said it felt like I'd just been on holiday.